right, we are going to get started. It is April 22nd, and we are going to talk about a COVID-19 update. And today, our topic by request is diabetes. So that is our wellness topic. For those of you who are joining us newly, we give a COVID update for the first half of the presentation. Followed by a wellness update, which provides something that you can actually do to make a difference in your own life and your family's lives around actually wellness. The topic is usually generated from someone that's in the audience. So if you have a topic that you want me to discuss, feel free to email me or put it in the chat, or you can even put it in the Q&A. All right. So today is April 22nd, and my name is Dr. Valda Crowder, for those that are new to this presentation. I'm also known as Dr. V. And I've been an emergency medicine physician now for 30 years, and I've treated patients across 4 pandemics, a Category 4 hurricane, and a mass shooting. You can follow me on Twitter and Instagram, and the handles are there. A lot of people ask me, where's the documentation and where are the old videos? And they are at AskDrV.us. So a lot of the source documentation and old videos are there. If there's something that you're looking for that you actually cannot find, make sure to reach out to me. I do respond to my emails. And at the AskDrV.us website, there's a contact us page, and I do respond to that. Okay, let's get ourselves started for today. All right, the webinar is 20 to 25 minutes, and then it is followed by question and answer, and the whole session is about 20 to 25 minutes. You can ask questions on the Q&A or the chat icon, and you can put those in now. So I tell people normally when we get started, we have questions often that are already loaded. The intention of the webinar is to keep participants informed about COVID-19 science that will help you and your family stay healthy during this pandemic. The outcome is that you'll create or improve an action plan for yourself or your family, or you may be creating or improving an action plan for a broader community, like a homeowners association or union or church. So as we've kind of discussed, what's happening now is unvaccinated people are really driving this last wave of what we are seeing. We are seeing unvaccinated people get hospitalized as well as going into the ICU. To date, I have only heard of one patient nationwide that I know of in my school that was vaccinated and was actually ended up in the hospital, and that was a transplant patient. So it was somebody that had a very, very severe diminution of his immune system. Whoop. I'm sorry. I'm sorry, this accidentally went forward on me. I apologize. All right, there we go. Globally, we've had 3 million deaths and just shy of 145 million cases. In the United States, we've had about 583,000 deaths and about 32 million cases. Now, while we are actually beginning to see some impact in the United States of vaccination, worldwide cases are surging. And this is important as we discuss variants and mutations, because variants and mutations are actually formed all across the world. So I tell people, don't let your guard down. This is not the time. We are, I think, rounding the last bend, assuming that people actually get vaccinated and continue to wash your hands, socially distance, and wear a mask. I keep this slide in here so African Americans, we all recognize what's at stake for us. African-American women are 3 times more likely to actually die from COVID-19 than white men. Similarly, African-American men are even higher than African-American women. Specifically, African-American men have lost 3 years in their life expectancy as a result of COVID-19. As I tell everybody, respect COVID-19. It only takes 45 seconds to become infected. If it's a variant, it could be less than that. About 60 to 80% of people who get exposed actually become infected. We've talked about how it gets into your body, and it gets into your body through a spike protein that then actually connects with a receptor protein, unlocks, gets inside your cells, and then begins to replicate. And it is during this replication process that mistakes are made, and those are the mutations. And there's some mistakes that are made that actually make the virus better. So then that particular form of the virus actually becomes the more dominant form of the virus. So you have 1 trillion cells in your body. So one person has 1 trillion cells. So as you can see, if this actually infects millions of people and everyone has 1 trillion cells, this copying process happens multiple billion trillions of times. Then it gets assembled and it heads back out. Dr. Fauci says the best decision he ever made as NIAID director was to actually fund the vaccine work. So the Moderna vaccine and Pfizer vaccine are a messenger RNA where they actually is coded for the spike protein. You produce the spike protein, your body recognizes it as foreign, and you develop antibodies. Then the second time you get the vaccine, your body actually recognizes it and actually kills it. So that's why people actually get a headache and a little bit of fever and sometimes get a little bit of a reaction. The Johnson & Johnson vaccine is a viral vector approach which uses a common cold virus and connects it with genetic material from COVID-19, and therefore then teaches your body to generate antibodies and then render it harmless. All right, so what's important here is Moderna and Pfizer are the ones that we're giving out now. Johnson & Johnson's on pause. The next one that we will actually probably see go for emergency use authorization is the Novavax vaccine, which was tested at a lot of different institutions, but it happened to be tested at Howard University. Janssen, I don't think we will see for a little while because that's 2 shots of Johnson & Johnson. AstraZeneca made some very critical mistakes in their study, and I don't think that they will actually be approved in the United States for emergency use authorization. So as we know, the Johnson & Johnson is paused, and it's paused over the clots. The clots are 6 women, I think there was a 7th man, out of 6.8 million doses, 18 to 48 years old, who had severe clots within 2 weeks of the vaccine. So if you got the Johnson & Johnson vaccine, I don't know, a month ago or 6 weeks ago, this is not something that we think you particularly have to worry about. This is really something that's 2 to 3 weeks within the vaccine from what we can see. Now, clots happen all the time, but here's the important part. If you have clots from birth control pills, you treat it with heparin, and heparin makes the condition better. If you have clots associated with the Johnson & Johnson vaccine, it cannot be treated with heparin, and heparin use actually makes the condition worse. So the reason why this has been paused is not because of the fact that it caused clotting, it's because they have to train the physicians that this clot actually has to be treated differently. So once they actually train all the physicians, you will see the Johnson & Johnson restart again. I know for myself, I'm going to the training that they're offering at our institution on May 4th. So I would not be surprised if you don't see the Johnson & Johnson vaccine start sometime around the 3rd or 4th week of May. Let's talk about the symptoms of a clot. It really depends upon where it is. If it's in your head or a cavernous sinus, and there's a headache and a facial droop, weakness of your arms or legs. If it's your lungs, it's more shortness of breath. And if it's in your legs, it's more swelling and pain in your legs. Now, the variants. These are the different variants, and this is not an exhaustive list. You have the UK variant, which has now become very dominant and is every state. You have the Brazil and South African variant, which are also increased as far as transmission rate. And then you have 2 California variants. So all of these right now, they're trying to figure out, how much do the antibodies work? How much does the vaccine work? This is what's going on right now with all of the studies and all the research. These variants, mutations are driven by high infection rates. And I want to that's how come you have a lot of variants from Brazil, United States, and we're going to have a lot of variants from India. If you take a look at India, India's infection rate is going straight up. And it shows no signs of abatement at all. It is the orange graph there. So what is happening between Brazil, India, and the United States? We are basically now the 3 drivers of this particular infection. For Brazil, they're overwhelming the hospitals. They actually used a Chinese vaccine, which was found to be only 50% effective against the variants. That's also causing problems. We've shown now that the Pfizer vaccine may be less effective against the South African and UK variants, according to an Israel study. So this is where the action is really going to be, is variants, variants, variants. And then there's a whole issue of, can you actually no longer transmit COVID-19 once you're vaccinated? And we are also still studying that. So I think we're going to see a lot of information come out over the next 30 days or so around these questions, so that we can actually figure out what's actually going to make sense. So when are you fully vaccinated? 2 weeks after your last shot. If you got the Johnson & Johnson, 2 weeks after the Johnson & Johnson, Moderna or Pfizer, 2 weeks after that. What can you do when you're fully vaccinated? You can be indoors with people that are also vaccinated, small groups. When I say small groups, 4 to 6 people without a mask and without social distancing. If you're visiting people who are not vaccinated, especially indoors, it is expected that you wear a mask and stay 6 feet apart. Now, today, right before this presentation, CDC announced that they are looking at revisiting the use of outdoor masks. So I think we may see some sort of change in outdoor masks. Also, if you're exposed to someone who has COVID-19 but you don't get any symptoms, you are not asked to quarantine. You still need to wear a well-fitted mask, stay 6 feet apart from people that you don't live with, and then we're all avoiding medium and large size in-person gatherings. All right, we have 215 million doses of the vaccine that have been administered, which is, I believe, record time. Obviously, that's not fully vaccinated people because some people are in the 2-dose regimen. We're roughly around 30% or so of the adult population registered, vaccinated. We will also probably see emergency use authorization the next 30 days for 12 to 16-year-olds. 40% of the Marines so far have declined to receive a vaccine. I think this is unfortunate. We need our troops to be healthy as they protect us and provide us with national security. All right, this is what everybody's been asking me about. Am I going to really have to get a booster? So we've had our first person in our community who's actually been registered for a booster shot. So there is now a Pfizer BioNTech booster, and it is a 3rd shot. I believe that is primarily set up because of the variants, not necessarily because the shot wears off. It's mainly because of all the variants. So it just stresses the importance of us really all coming together as a world and actually eradicating COVID in all countries, because it makes a difference for all of us. Now, what if your family doesn't want to get vaccinated? Encourage them to talk with their doctors. You don't want to make them wrong. Listen to what they have to say. Remind them that qualified people studied the vaccine, that medical professionals stand by it, and that the side effects of getting ill from COVID-19 are much, much more serious than the vaccine. Also, I normally remind people, you're going to be helping protect others, and we're all trying to get back to society back to normal more quickly. There's going to be certain things that the vaccine is actually going to be required. I've mentioned before that the vaccine is going to be required on cruises. The other thing that came out today is that, and I didn't get a chance to add it to the presentation, is the vaccine is going to be required for all Cal State and University of California students. If you have a vaccine card and you want to get it laminated, you can do that. Just make sure the information is correct and have a copy of the front and back saved, and make sure that you've completed your immunization series. Dr. Burke said everything over 100,000 could have been mitigated. You know, I just think, you know, we really have to look back and see what we could have done differently and done better so that we actually do it better next time. Dr. Fauci said he's fully vaccinated, but he still will not eat inside of a restaurant. So I tell people all the time, follow what the doctors do, look at what the doctors do. So I provided that. People ask me this question all the time. Do I go, Dr. V, do you go to a restaurant? I go to restaurants that have an outdoors or indoor-outdoor seating where they have a doors, and some of them have even walls of the restaurant that are completely open. I do not go to a fully inside restaurant. Lastly, there's a hotline to get funeral aid for burial services for anybody who's had COVID-19 patients who have actually passed in their family or friends. All right, let's go on to our wellness topic. I'm excited about this because this is diabetes. A lot of people have asked me about diabetes and how to prevent it. And I'm going to go over a bunch of different things. But let's just start with the pancreas. The pancreas is located inside of your abdomen. It has two functions. One, to help with digestion, and the other one is to actually regulate blood sugar. Now, diabetes is a disease that occurs when your blood sugar is too high. Some people call it, I got the sugar, same thing. It's just that your blood glucose is too high. The blood glucose is the main source of energy that comes from the food you eat. Insulin is released by the pancreas and helps glucose from the food get into your cells and use it for energy. So there's three types of diabetes. Type 1 can develop at any age, but it mostly occurs early in life. And this is when you're not born with enough cells to produce insulin. Diabetes type 2 is more common in adults. It accounts for about 90% of all diabetes, and people call it adult onset. And this is the type 2 is the type of diabetes that is really preventable. Then lastly, there's gestational diabetes, which occurs when people have a high blood glucose during pregnancy, and it's associated with complications for both the mother and the child. What's important is that women who have gestational diabetes, 50% of them will go on to develop type 2 diabetes. So if you have gestational diabetes, or if you've had it associated with a pregnancy, you are at risk for later developing type 2 diabetes. So let's talk about how you know you have it. So main thing is weight gain. You're always hungry. You're always thirsty. Your blood pressure is high. Numbness or tingling in your arms or legs. Unexplained weight loss or unexplained weight gain. Some people get dizziness or sort of like feeling like the room is spinning. Frequent urination is a common. People think, oh, I have a urinary tract infection. And really what they have is their blood sugar is out of control. Eye damage is another one. People say, you know, I rapidly have had deterioration in my vision. That is also as a result of diabetes. Some people also get impotence and abdominal bloating. So these are the things that are associated with diabetes. So, but the big three symptoms, polyuria, polydipsia, and polyphagia. Now, what does that mean? Poly means a lot. So you urinate a lot, you drink a lot, and you eat a lot. Those are the big three symptoms of diabetes. So one way to diagnose it is to actually get a 2-hour glucose, a fasting glucose, or a hemoglobin A1c. If you are over 40, you should have your hemoglobin A1c checked on a regular basis. And I'll go over a little bit about what that is. So I just shared here a chart that actually shows some of the normal levels and some of the abnormal levels. Now, if you think you have diabetes, obviously you want to make an appointment with your doctor. Let's talk about some of the tests. Hemoglobin A1c, it shows what your blood glucose has been averaging over the last 2 to 3 months. It does not require you to fast or drink. It is really the best test because your doctor will say, oh, come in and get some blood work and don't eat or drink before you come in for your blood work, which a lot of people do, and then things will look good. But the hemoglobin A1c tells you what's been happening over the last 2 to 3 months. The fasting glucose is what a lot of people actually have gotten. That's a really late indicator. If you're fasting and your glucose is still high, that means you've really been a diabetic for a while. The oral glucose tolerance test is what they give pregnant women. They actually give you something to drink that has a lot of glucose in it, and it's a sweet drink, and then they wait 2 or 3 hours and see how much your glucose actually goes up. And then there's just random plasma glucose testing, which might occur when you go to the emergency department or something. So hemoglobin A1c is really, really, really important. I cannot stress how important hemoglobin A1c is. On the left here, that shows healthy red blood cells have some glucose stuck to them. Hemoglobin A1c means an unhealthy amount of glucose is stuck to the cells. So the hemoglobin A1c normal level is 5.7 or lower. When you're 5.7 to 6.4, you are a pre-diabetic. That means you need to do something, and you need to do something quickly. And it's usually diet and exercise. 6.5 and above is diabetes. If you are over 40 years old and you do not know your hemoglobin A1c, I would suggest call your doctor tomorrow and ask that you get a hemoglobin A1c level done, or ask what it is. Go into your patient portal, see if they had one done. Now, common treatments are obviously insulin, but if you're a type 2 diabetic, they usually start you off first on a pill. And then you also have checks of your blood sugar at home. The most important thing that you can do is diet and exercise. That is actually going to make the most difference, particularly if you are a type 2. So how do you know if the treatments are not working? One is the hemoglobin A1c keeps going up. So that's the most common indicator. The other thing is that you feel lethargic and thirsty a couple hours after meals. You might feel shaky or dizzy. You have a constant craving for carbohydrates like sweets or bread or fruit. If it's been more than 5 years since you've had your medication doses adjusted, you need to have everything checked. And then also having a fasting blood sugar that's above 130. Now, here's why diabetes is so important, and this is why I wanted to talk about it. It affects a lot of different organs in your body. So it affects your eyes, your kidneys, your extremities, your cardiovascular system, your heart, your brain. It is a multi-system disease, and most people don't realize to what extent it is. So, you know, when I say a multi-system disease, these are all of the things that diabetes actually really impacts. So it really, and some people get more symptoms in one area than another. So if you look at your eyes, you can get retinopathy and blindness. With oral health, you can get periodontal disease. With heart disease, we can have heart attacks and strokes. You have a lot of people who have kidney failure because of diabetes, and they end up on dialysis. You can get birth complications and defects. You've got folks that get pins and needles, or what they call diabetic neuropathy, and they can't feel very well. And then what happens is they kind of accidentally hit their foot or injure their foot, and they don't really know it. And then they get an infection, and then the infection doesn't heal very well because they've got poor vasculature. And then that's how they wind up with the amputations. So that's associated with a loss of sensitivity. And that's how they get the ulcerations and the amputations. For the eyes, we see diabetic retinopathy, which can cause blindness. You also see cataracts, and we also see glaucoma. Heart disease. This is really, really a big one. Diabetic patients have 200 to 300% the increased risk of heart disease. 30% of them get more stents. 300,000 patients a year have heart disease and heart attacks, primarily because of diabetes. And then they also have lower morbidity and mortality. Higher morbidity and mortality rates. And this is with diabetes only. So if you add high blood pressure or something else like that, then you're only compounding these things. So this is a really big one. I think this is something where people can really make a difference in their lives. With the diabetic neuropathy, what happens is they start to get proteins leaking into their urine. And then with the proteins leaking into your urine, your kidneys begin to be less and less effective over time. And then some people wind up on dialysis. All righty, just a little bit about your liver, because your liver is a very, very important place. What happens really is, your liver actually sends out glucagon when your blood sugar gets too low. And then your pancreas sends out insulin when your blood sugar gets too high. So if you're going back and forth and you're bouncing back and forth, it causes a stress on your liver. And then you can eventually actually get a fatty liver and then cirrhosis. Diabetes is also associated with Alzheimer's. 80% of the people with Alzheimer's have insulin resistance or some form of diabetes. So even when you're talking about brain health, diabetes or pre-diabetics plays a major role. All righty, I am going to go to Q&A.